see a chiropractor if you have some type of sciatica, pain, numbness, tingling going down the leg? Very good question. And this is a question I got yesterday on the channel, and I thought, hey, I'll create a video. So in this video, I want to answer that question to help you kind of figure out, is a chiropractor the right person for me, or is it an option for me? Now, keep in mind when we talk about chiropractic, realize there are many different types or sort of niches within the chiropractic world, but I'm going to refer to the very traditional kind of old school chiropractic approach where we're talking about sort of hands-on adjustments or manipulations. And so in this video, I want to help you answer that question of should you or should you not see a chiropractor? Are they the best person for you? And I want to do so by kind of walking through three different layers, if you will. So the first one is, what does the research or the science say about manipulation or hands-on treatment for sciatica pain? The second thing is that I want to help you understand the pros and the cons of relying on someone else to move your body, in this case, chiropractic. And then the third thing is I want to help you and kind of give you a way to best understand and figure out whether or not the chiropractic care that you're getting is actually solving your problem. So nothing against the chiropractic profession, but just medicine in general. We create this sort of dependency, if you will. So you go to the chiropractor, you get your back cracked, your neck cracked, all these different things. You get up, maybe you feel a little bit better. And it's often this reoccurring business model where you go and then you leave and the problem comes back and you have to keep going. So how can you get ahead of that? How can you figure out if the treatment that you're getting is valuable and is actually working? So I want to point out some mistakes that people often make and maybe some things you weren't aware of. Real quick, for those of you who do not know me, thanks for checking out my channel. My name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic board specialty, and basically I teach people all around the world with unresolved back, butt, and sciatica problems how to fix themselves using basically the mind and movement as medicine. If you're still not sure if you have sciatica, be sure to check out my DIY diagnostic guide above, where I walk you through all the specific movement tests needed to figure out the most likely source of your symptoms. So let's talk science first. So in 2004, there was a research study that was done and identified what we call clinical prediction rule. And for those of you who do not know what that is, basically it's a tool to help clinicians, people like myself or chiropractors, or other practitioners who treat people with their hands, to best identify people who will respond to hands-on treatment or manipulation of their lower back. So let's just say, for example, you walked into my clinic. What I would know based off this clinical prediction rule is that if you have symptoms that started recently, less than 16 days is what they found, and you have no symptoms that go below the level of the knee, then the chance you're going to respond to some type of manipulation or hands-on treatment to the back goes way up. It increases your chance of success with manipulation to the low back. Now here's the catch. If you have true sciatica, chances are that your symptoms are below the level of the knee. You probably feel pain into the calf, or maybe pain into the foot, or numbness and tingling in the toes. And so just by the presentation of what is sciatica, which is most commonly pain that goes, again, below the level of the knee, the chance that you will respond to hands-on treatment or manipulation of the back goes way down. So is chiropractic for you? Well, if you have symptoms below the level of the calf and you're getting traditional chiropractic hands-on treatment to the spine, maybe not, because that goes against what science says works best. So just something to think about. Now I want to share with you sort of a sneaky little way to determine if what you're doing at the chiropractic office and or the treatment that you're getting is valuable and is working and worthwhile paying for and worthwhile of your time and your attention and your energy. So here's what you would do to figure out if chiropractic treatment is helping. So if you plan on going to see a chiropractor, you can kind of put this system in your brain, and or let's just say maybe you already have a chiropractic appointment scheduled, or you're going to see someone who's going to do hands-on treatment on you. So what you would do is this, and it would start in the waiting room or prior to the visit. First thing you would do is you would self-assess. So let me show you what I mean. That being said, science isn't everything, and sometimes research lags. So what does my experience tell me? What are my personal thoughts? So one thing that I want to suggest to you is that all rehab is motion. And so whether you go to see the massage therapist, or you go to the chiro, or you go to the PT or acupuncture, or maybe you see an osteopath or something like that, if you're watching this from across seas. Here in the US, osteopaths don't do too much hands-on stuff. But either way, you can either go to someone and they can move you, or you can learn to move yourself. And so talking from experience, I actually used to teach some manual therapy courses and classes, and I came from a very manual therapy or hands-on background. I was trained by osteopaths, things like that. And so as somebody used to crack lots of necks and backs, I was very good at fixing people in the moment, but the people in pain, you watching this, were terrible at fixing themselves. And so what I recognized is that it was a great business model. Crack their back, people would leave, the problem would come back, right? But I didn't feel it was best for folks because I wasn't teaching them what they needed to know to fix their own issues. So just recognize that if you go to the chiropractor, there's nothing wrong with that. But usually you are paying to sort of borrow their knowledge for the moment that you're there. And they crack your back and they do things, but you're relying upon that person, that chiropractor in this case, to solve your problems. Is that really what you want? Is that sustainable long term? And so it's one thing if your car breaks down. You just go, you drop it off, you get a loaner, and you go on with your day, right? Call me when it's ready to be picked up. But if your body breaks down, you can't really do that. And so wouldn't it be useful to be able to move yourself and have the knowledge and tools and understanding to do that? And I'm telling you that if you've ever cracked your own back, then the chance that you need someone to crack your back and need to pay them to do so is not high. You can move your own body, and while you may not be able to move it as quickly or as specifically, recognize that it's all just motion at the end of the day, so you have to make a choice. Do you want to pay a chiropractor to move you, or do you want to learn to move yourself? Because usually you can move yourself, and because you're the one with pain and you have that experience, which the chiropractor does not, you directly tie into the pain experience, and you can often move yourself more efficiently, more effectively, because you can actually get immediate feedback about what's happening. All right, so the first step to figuring out if any treatment is useful is to test. So what we're gonna do is, again, let's just say, shh, be quiet, you're in the office, okay? And or maybe you're in your car getting ready to head into the chiropractic office. First thing you want to do is you want to test and find a yucky motion. You want to get a baseline assessment so you can determine then in a moment if the treatments that are done actually change your baseline and improve your movement experience or improve how you're feeling. So we've got our patient here, right? And so let's just say they have sciatica in their left leg. Well, one of the most common things that sciatica will cause is what we call a positive straight leg raise. It's going to cause the leg that you have pain in to be and feel yucky when you stretch it, because when you stretch it, you're stretching the nerve in your leg, and if the nerve's unhappy, it's going to say, ouch, don't do that. So what you would do is you would sit there and you would test on your good leg first. So let's just say I think I said her left leg was her bad leg, right? So go do your right leg, pull your toe up, straighten it, let it down. Okay, now pull your toe up. That puts more tension through the back of the leg on the good side. Go ahead. And you get an idea for how that feels. Does it feel okay?
Good.
Great. Okay, so now pull the toe up. Do this slowly, by the way, on the left side. Now slowly straighten it. Stop when you feel anything. Where are you?
Over here.
Okay, so you can see she's got a yucky leg raise, and the right side in this case went fine, and then the left side didn't. So she found a yucky leg raise, and she kind of just took a snapshot of that in her brain, or at least that's what I'd ask you to do. Get a sense for what it feels like, how far you can go, what the sensation is like, and then you're ready for this next step. All right, so I'm Dr. Charlie Johnson, and no, I'm not a chiropractor, but I'm a physical therapist. But let's just pretend that now you are laying on the table. So unbeknownst to me, the chiropractor, you were in the waiting room, and you were self-assessing yourself because you watched me, you have some dirt, and you figured out a little bit of a system, okay? So you self-assessed, you checked your leg raise, you got a yucky leg raise, and ow, it goes there, and you start to grimace. Okay, so now, Dr. Charlie, the chiropractor, right, should have my white coat on, starts to do treatment. So let's just say, again, I'm not gonna try to butcher this, so again, this is nothing against chiropractors, but let's just say I'm doing some quick hands-on treatment. You've got 5 minutes for some different adjustments, total body adjustments here, okay? So let's just say we work on her neck first, right? So we do some different things. Oh, it feels a little stiff, a little tight. I'm gonna roll you towards me. Okay, just relax, breathe, and out. Alrighty. This leg's a little bit longer than the other one, so we're gonna pull this one to make it even, okay?
Okay.
See this arm? Okay, I'm gonna come up under here. Just relax. Cool. All right, so maybe you heard some of these snap, crackles, and pops, but either way, you might be wondering before you go schedule next week and the next week forever, how do you know if that was valuable, right? So yes, everybody likes to get their back cracked. Well, a lot of people do, and or massage and do these kind of feel-good treatments, but how do we know it actually did something? So here's the final step, and then we point out some little sort of fatal flaws or mistakes that you might want to think about, or some issues that I have, all right? So what you would do, Heather was super smart, Heather being my wife, is she would go back to the waiting room. Can you guess what we're gonna do? Retest. Super smart. Yep. All right, so what you're gonna do is remember back to before we did all that stuff on the table, what you did. You tested your yucky leg raise and you found that it felt yucky at a certain point and you had a certain amount of motion, something like that. So go ahead and retest and let's see if what I did was valuable. Go ahead.
Should I do the good leg too?
Let's do the good leg, sure. Let's just make sure we didn't make anything worse there. Looks good. And now do the yucky leg. Okay, what do you got? Same, better, worse?
Same.
Okay, so if same, what does that mean? Heather, do you want to keep scheduling appointments?
No.
Okay, well, look, she could, but here's the idea. What it means is this. It means that the interventions that we just did on the table, for example, weren't very valuable. They didn't change anything. They made 0% improvement, and 0% times no matter how long you want to keep doing something equals 0% change, all right? Now, let's just say she retested. By the way, she could schedule another appointment because we would want to switch up the treatment that we're doing. So maybe what we did there didn't work, but there's always other options. So as long as we continue to test different things, that's fine. All right, so now go ahead and retest and let's give a different result, okay?
Okay.
Woohoo! All right, so same, better, worse. Better, cool. So if leg raise or yucky motion was better than the interventions we just did or something between the waiting room and what we did and when she sat back down helped, all right? And so there seems to be value in that treatment. So that's something that ideally, this goes back to the move you versus learn to move yourself, ideally the chiropractor would teach you how to treat yourself and teach you how to do exercises that replicate what they did and or give similar benefits to what we just observed, right? So if the leg raise improved, it means the chiropractic or the treatment was valuable, or at least something about it. We'll get to that point in a minute. Now let's just say final result.
Okay.
Ugh. Super yuck, right? Super yucky. More yucky. Worse, right?
Worse.
Okay. So that tells me that the hands-on treatment that you just received made you worse. Something about it didn't help, right? And so you definitely don't want to do that again. You want to stop that. She mentioned a moment ago that she did her leg raise. Woohoo, it was better. Remember that?
Yes.
All right, so in that case, she might walk away and she might say, you know what? I love chiropractic, and I'm going to tell all my friends because that chiropractor cracked my back and did this and did that, and I walked out after that treatment. I felt amazing. But what was it about the treatment? This is the problem. So we have these scientific degrees, but we don't apply the scientific method. So did you notice the flaw in the treatment? The flaw was that I cracked her neck, and I cracked her mid-back, and then I pulled on her leg, right? And then I cracked her lower back. And so I did basically 4 different things within a couple minutes or within the, example intervention, if you will. And then I had her retest. And so what was it? Was it intervention A of the neck, B of the mid-back, C of the leg, or D of the lower back, which made the change? And so here's how you can be super savvy and sort of challenge your healthcare providers and or yourself to just be better people, all right? What you would do is you would say, hey, you cracked my neck. Now, I don't believe that would help my sciatica, but let's see. You've probably heard of crazier things, right? The whole body's connected, by the way. Your head or your neck is in a different body than your lower back. So you cracked my neck. Now, I didn't tell you this, but I actually checked and found a yucky leg raise in your waiting room. I was in your waiting room, and I self-assessed, and I found this yucky leg raise. And then you cracked my neck. Hold on a second. Don't pull on anything else. Don't crack my mid-back yet. Go, let me check my leg raise. Now, let's just say that it was no better. It was the same. Okay, cracking the neck does not change your sciatica. We have proof of that. We have evidence. Great. Now go ahead and crack my middle back, right? Remember we did that? Or you could say to the chiropractor, let me get up again. I'm going to retest my leg raise. Was that same?
Same.
Same. Okay, great. All right, so now, hold on, let me get back on the table. Now check my legs again and pull on my leg. Pull on my leg. Great, cool, got some cracks there. Now let me go check my leg raise again. Go check your leg raise again.
Better.
Better, aha. So, that's exactly what I wanted, by the way.
Oh, good.
So, what does that tell you? Pulling on the leg in this case, as compared to the crack of the neck and the crack of the mid-back, helped improve your yucky motion and improve your movement experience. And you have evidence of that because you tested, treated, retested, and you isolated the exact thing to find what was most valuable of that chiropractic treatment. Now, would you move on and would you say, hey, go ahead and crack my back now?
No.
Why not?
Because it made me better already.
Yes, you found the one thing that made you better. You've been working alongside me too much. All right, so you would stop there. If you found something that worked, if I had this light behind me and it burnt out and I was replacing bulbs and this didn't work, that didn't work, the neck didn't work, the mid-back didn't work, you get the analogy hopefully, and then the leg pull, that light bulb turned on the light, why would you go buy another light bulb and keep trying, right? You wouldn't. And so at the end of the day, you would stop at the leg pull because you have evidence to believe that that worked. And you would not have to go to the final intervention D, cracking of the back, because, well, you found something that works. Doesn't mean you couldn't try it if you want, but you get the idea. And so a lot of people lump in chiropractic treatment or my massage therapist is great, but they continue to go for years for the same problem, in which case, well, probably not that great. And or number two, they don't isolate that which is helping them, or they don't isolate what about the specific treatment is most valuable. So they just know that everything about the treatment maybe is somewhat helpful for whatever reason, but the limitation in that is that you could be wasting a lot of time. Imagine if you could go and you could get one body part, say, adjusted or manipulated and have all the results, instead of having to pay for millions of different things to get adjusted, right? And then you would want to ask yourself, and you would want to ask the chiropractor if you were super sharp, what would you ask? What would you ask me?
How could I do this myself?
How could you do this yourself? Perfect. So she's too smart. We're not going to get a lot of money out of her, all right? The idea is that then she, being a very inquisitive person, right, and you as somebody watching this maybe on YouTube or somewhere else, should ask, hey, Mr. or Mrs. Chiropractor, how can I do that myself? So I could pay you to pull on my leg, but we just isolated that was the one thing that worked. So can I maybe pull, get my husband to do that? No, I'm not recommending that per se, but it's not that complicated, okay? Or maybe you could hook up a band to your leg. You can do different stuff like that. And the idea is you're trying to get a similar effect, all right? So hopefully this was useful, all right? So a few things. Science suggests that if your symptoms are acute, less than 16 days onset, happened recently within the past couple weeks, and symptoms do not go below the level of your knee, then the chance you respond to some type of manipulation is favorable, is good. In this case, if traditional chiropractic is manipulation, then sure, why not, all right? But most people with sciatica have symptoms below the level of their knee, into their calf or their foot, which reduces the chance, based off science, that you will respond to hands-on treatment to the back, manipulation. Also, you can rely on someone else to move you, or just like I was alluding to, you can learn to move yourself. Which do you prefer? Which puts you in more control? And then finally, be super sharp and savvy. Test yourself in the waiting room. Prove that what is happening in the treatment room is working. Challenge others to be better and scientific. And then ask yourself, once you find what works, how you can replicate that, bottle it up, optimize the dose, the frequency, and timing, and use that as medicine to treat yourself. Hopefully it's helpful. Let me know your thoughts in the comments below. Should you see a chiropractor? Well, again, I'm not saying yes or no. I'm just giving you some advice. What are your thoughts? Also, make sure to hit the subscribe button as well as the bell for notifications when I go live every single week with new content, or at least I try. And then finally, hit the like button. Thanks so much. Chat soon.